Hello! Do you have prediabetes or diabetes and want to lower your blood sugar quickly and effectively? In this video, I'll show you a simple tool to reduce your blood sugar faster than anything else, and it's consistent. Whether you're pre-diabetic or already diabetic, regardless of if you're type 1 or type 2, you should use these methods every day. So, what's the method that can immediately lower your blood sugar and reduce your average blood sugar, HbA1c? Do you know? If you guessed improving your insulin sensitivity, you got it right. By improving your insulin sensitivity, you'll have much better blood glucose control. If you have type 2 diabetes, you might even be able to reverse it or prevent diabetes if you're pre-diabetic. Isn't that amazing? I'm going to give you 7 tips, plus a bonus tip in the middle of the video for even better results, so stay tuned until the end. This video is crucial for you. But first, give it a like. Subscribe to the channel so you don't miss out on our health tips, and turn on notifications to catch our future content. And share this video with friends and family because there are so many people with diabetes, prediabetes, or insulin resistance. You'll be helping a lot of people, so share it. And tell me, do you have diabetes or prediabetes? Do you want to improve your blood sugar levels? Where are you watching from? Leave a comment below. What is insulin sensitivity? Let's go! Insulin sensitivity indicates how your body reacts to the insulin your pancreas produces. If your body responds well, it's sensitive to insulin, which is a good thing. If your body responds poorly, it's resistant to insulin, meaning it's less sensitive to it, which is a bad thing. In case you didn't know, insulin is a hormone produced by the pancreas and is crucial for good blood sugar control. When you eat something like bread, a banana, rice, or beans, your blood sugar rises, and the pancreas starts producing insulin. Insulin's job is to control the sugar that enters your cells. Without it, it's like the doors of the cells are locked, and sugar can't get in, staying stuck outside. And where's that outside? In your bloodstream. So if you lack insulin or if your body isn't very sensitive to it, your blood sugar will rise. Therefore, if your body is sensitive to insulin, your blood glucose levels return to normal quickly after you eat. But if your body is insulin resistant, it's as if the key doesn't quite fit the lock. It's much harder for glucose to enter the cells. It's like a key that's a bit faulty. Have you ever had a faulty key? Is it easy to open a door with it? Not really, right? That's why, when you have insulin resistance, it takes longer for your blood sugar to return to normal, or it might not return to normal at all after eating. Can you see how insulin resistance is directly related to prediabetes and diabetes? About 70% of obese people have insulin resistance. Nearly 50% of overweight people have it. And even among thin people, 20% have some level of insulin resistance. And here's something interesting. If your body becomes insulin resistant, your pancreas will need to produce more insulin to clear the sugar from your blood. The more insulin resistant you are, the more insulin you'll need to overcome it. On one side, your cells no longer want insulin, and on the other, your pancreas has to make more insulin. At some point, the pancreas won't be able to keep up. It'll be overworked. And what happens if it can't perform its function? You'll become pre-diabetic, and eventually, diabetic. These tips I'm about to give are aimed at making your body more sensitive to insulin, so the key fits perfectly from the start. And it doesn't matter what type of diabetes you have. The more sensitive you are to insulin, the less insulin your body will need to keep your blood sugar at normal levels. Tip number 7. You need to sleep better. See how important this is. When you sleep poorly, your insulin resistance increases. The key doesn't fit. But do you need to sleep poorly your whole life? No. Just one bad night's sleep increases insulin resistance. The opposite is also true. If your sleep is poor and you start sleeping better, your insulin sensitivity improves. When you sleep poorly, your body becomes inflamed, increasing C-reactive protein levels and messing up your metabolism, especially due to cortisol. It also increases ghrelin, a hormone that makes you hungry, reduces leptin, which helps you feel full, so you won't want to stop eating, and lowers growth hormone levels. While it won't make adults grow, growth hormone helps you build muscle and reduce fat. If you want to improve your glucose levels, you need to have a routine for sleeping and waking up. Don't let light or noise interfere with your sleep. blackout curtains are ideal, or if that's not possible, sleep masks and earplugs work well too. And of course, cut out caffeine after PM, even if you think you can sleep well after having coffee at dinner. Caffeine disrupts sleep cycles, so you're not reaching the deeper, restorative stages of sleep. Tip number 6. You need to control your stress. If you have diabetes, you probably know that when you're very stressed or anxious, your blood sugar skyrockets. Stress is similar to lack of sleep. You produce stress hormones like cortisol, adrenaline, and glucagon. Glucagon, in particular, breaks down glycogen in the liver, releasing glucose into the blood as a quick energy source. But here's the thing. Chronic stress is even worse because it keeps these hormone levels elevated over time, making it even harder for insulin to work. This means the key doesn't fit in the lock, and it becomes difficult to use insulin effectively. Chronic stress makes your body produce more insulin, and too much insulin can lead to weight gain, particularly in the abdomen. Abdominal fat, also known as visceral fat, is the most dangerous type, often leading to fatty liver and contributing to insulin resistance. That's why if you're stressed, you'll find it challenging to lower your blood sugar, even if you're following other healthy habits. Managing stress through relaxation techniques, exercise, or even therapy can significantly help improve insulin sensitivity and blood glucose control. How to reduce your stress? Improving sleep helps. Breathing techniques can also make a big difference. One of these techniques is the 4-7-8 breathing method, which can quickly reduce stress and tension. Inhale slowly through your nose while counting to 4. Hold your breath while counting to 7. Exhale completely through your mouth while counting to 8. This simple method helps activate the body's relaxation response, reducing tension and calming the nervous system. Practicing this breathing technique daily, or whenever you feel stressed, can make a noticeable difference in lowering stress and supporting better blood sugar control. Tip number 5. Exercise. This is extremely important for quickly managing diabetes and making your body more insulin sensitive. Exercise helps you sleep better, reduces stress, and boosts mood. Plus, when you exercise, your muscles need more glucose. Whether you're walking, your legs need extra glucose, or moving your arms, they'll need it too. What happens to your muscle cells? They start absorbing the excess glucose from your bloodstream, and you need less insulin. You'll improve your body's insulin sensitivity right away, and the effects can last from 2 hours to 2 days, depending on the type of exercise. Even lifting weights will build more muscle, and muscles are powerful glucose burners. Exercise also regulates hormones, like increasing testosterone in men, and it's even more effective if you add leg exercises. And it helps reduce belly fat, which lowers inflammation. This creates a positive cycle where each improvement boosts the next. That's why I emphasize exercise so much here on the channel. It's no accident. What kind of exercise? Walking, cycling, water aerobics, swimming, or even jumping jacks at home, anything works. The goal is to get moving. If you're short on time, here's a tip. A 2022 study showed that walking for just 15 minutes after eating can improve your blood glucose. Even 2 minutes of walking can have a small impact. So if there's just one takeaway from this video, let it be this. A 15-minute post-lunch walk can make a difference. How much exercise should you aim for? At least 150 minutes of moderate activity per week. But if I had diabetes, I'd aim to exercise every day. Tip number 4 to improve insulin sensitivity. Increase your fiber intake. Fiber. If there's one thing essential for blood sugar management, this is it. Eat more fiber. It might sound surprising, but solid, indisputable evidence shows that fiber is one of the best supplements out there. Soluble fibers, found in foods like oats, apples, legumes, and some types of beans, form a gel in the stomach and intestines, slowing down sugar absorption. This means fewer blood sugar spikes after meals. With fiber, sugar absorption is more gradual, helping stabilize blood glucose levels. One study found that patients who added 2 tablespoons of fiber before meals saw significant reductions in their blood sugar levels. We're talking about a 13% reduction at breakfast, an impressive 65% at lunch, and 41% at dinner. And the beauty of fiber is that it keeps working. helping manage blood sugar throughout the day. Do you need to buy fiber supplements at the pharmacy? No. Fiber is present in all plant-based foods. We're talking about vegetables like spinach and broccoli, low glycemic fruits like pears, apples with the skin, avocado, and kiwi, as well as legumes like beans and lentils. But my personal favorite is chia, which is high in soluble fiber. That's why it forms a gel when mixed with water and can be easily added to various dishes. The goal is to increase fiber intake to more than 35 grams a day, which can be achieved through both foods and supplements. Regarding supplements, check the video description for some options. We recommend Sugar Defender and Glucose 6. They help regulate blood sugar levels by supporting glucose metabolism and providing weight management support. These supplements are often recommended for those with diabetes, prediabetes, or anyone looking to prevent sugar spikes after meals. They stabilize blood sugar levels with natural ingredients that help regulate glucose absorption, avoiding sudden sugar spikes and crashes. This is particularly important for people who need to keep these levels steady to prevent complications. Links to the official site with a special discount are in the description, don't miss it. Tip number 3. Cut sugar and reduce refined carbohydrates. Another essential step is to cut back on refined carbohydrates like bread, pasta, instant noodles, and cookies, and eliminate sugar. This will help make your body more insulin sensitive. Diets high in refined carbs tend to cause blood sugar spikes, while eating smaller portions of carbs, especially when paired with fiber and protein, provides the body with less sugar per meal. This makes insulin's job easier and prevents glucose spikes. Maintaining a steady meal schedule supports insulin sensitivity, and choosing low glycemic index GI carbs is even better. Options like chickpeas, beans, lentils, and sweet potatoes are great because they release sugar into the blood more slowly than regular potatoes. If you think, but I can't live without pasta or bread, consider trying whole grain pasta, which is higher in fiber, or make whole grain bread at home. If you'd like a specific video on eating for diabetes management, let me know in the comments. If there's enough interest, I'll make one. Also, it's crucial to cut back on sugar, especially ultra-processed foods, as they often contain high fructose corn syrup. Studies show that high fructose intake can increase insulin resistance, lead to diabetes, and even cause fatty liver. So, be careful. Now, if you're substituting refined carbs with unhealthy fats like bacon and sausage, you might be doing more harm than good, as these can also worsen insulin resistance. The best strategy? Cook more meals at home using whole, minimally processed ingredients and avoid fast foods and anything you know might be harmful. Remember, smart food choices make all the difference. Tip number 2. Don't just cut things out at spices and special ingredients to lower blood sugar quickly. If, like me, you enjoy alternative options, you'll be happy to know that adding cinnamon, ginger, turmeric, fenugreek, and garlic to your diet can help improve insulin sensitivity. Herbs like rosemary, basil, and oregano all contain bioactive compounds that help reduce inflammation, making it easier for your body to process glucose. There are also 2 drinks that can help. Apple cider vinegar can increase insulin sensitivity, lower blood sugar levels, and seems to slow down the release of food from your stomach to your intestines. The other drink is green tea, which contains epicatechins that help improve insulin sensitivity as well. Tip number 1. The most important: lose weight. If you're above or well above your ideal weight, it's essential to work on losing weight. Now, if you're already at a healthy weight, this tip doesn't apply to you. Why is weight loss so important for improving insulin sensitivity? Let me reiterate: losing belly fat will reduce inflammation, as visceral fat is highly inflammatory. This fat also makes you more resistant to insulin, meaning your keys simply won't fit. Obesity is a major factor in insulin resistance. Losing weight can improve your sleep quality, reduce snoring, increase your energy, and help you stay active. More importantly, it relieves your pancreas, giving it a well-deserved break. Remember, producing too much insulin can increase your risk of pancreatic cancer. It also raises the risk of breast, colorectal, kidney, thyroid, and uterine cancers. If you want to live well and healthily, Losing weight is key. Small changes in your diet and lifestyle can have a significant impact on blood sugar control. I hope you'll incorporate many of these tips into your daily life and that you can either reverse diabetes or avoid it altogether. Give these tips a try. I'm confident you'll see improvement. And don't forget to check the video description, where we've included supplement recommendations to help you maximize your results. Did you enjoy the video? Remember to like and share it with the special people in your life. See you in the next video. Thank you so much.